You guys, wanted to bring you new breaking information in the Shanquella Robinson case. It looks like we might have new hope. The FBI is involved and they are investigating. But did you know that the reason what the FBI and what seems to be taking so long with the investigation is the doctor, the police officers, and all the missing pieces? We have the information about that. And also, let's take a look at the doctor involved in Shanquella's death. Now, as you know, there are local people saying that the doctor shouldn't be charged because for whatever reason, the doctor operated from false information. We actually thought about it and said, what type of doctor would be so just foolhardy? We know that she did not administer CPR properly. We know she did not follow medical protocol, either in Mexico or in the United States. We know that that IV bag that she bought to treat alcohol toxicity was at best gross negligence. At worst, it was something more insidious. Well, guess what? We're not the only ones that think that. The FBI also thinks that as well. And even though we've been led to believe that the Mexican authorities are looking into pressing charges, it's actually the FBI that got involved that is moving this investigation along. Again, the wheels of justice seem to be creaking slowly, but they are moving the investigation along because they want to know what's going on with the doctor, the police officers, and they also want to know what's going on with those two EMTs. Nobody is safe out in these streets, and that's exactly what should be going on. All right, let's get into this. And before we get into it, you guys, you can stay till the end and I'll explain why the doctor did not follow medical procedure. But please don't say the doctor just went by what the friends told her. Don't you know? Have you guys ever seen a doctor in America or overseas? What doctor relies on not the patient, but their friends to tell them what's wrong with them? And they're not even next of kin. Every doctor that is in first-year medical school knows that alcohol poisoning needs to be treated in the hospital because you need a tube down your throat. You need special medication that helps get the alcohol out your system. You also need blood tests performed to see where you are and how they should monitor you. You need your stomach pumped. Yes, you need an IV, but the IV needs to contain thiamine and a few other things to make sure you don't get brain damage. She came with none of that. We also found the clinic that she came from. And oddly enough, even though she was with the American Medical Clinic, which is, and we're going to get into this later, but let me just give you guys the plot. The American Medical Clinic, which even though we keep saying clinic, it is a huge hospital in Cabo, right? They have everything. They even have the MRI machines. As a matter of fact, they even have the MRI machines. For some reason, they sent her from the walk-in clinic. Why is that important? Because of Nasir's live. And again, his live keeps coming up in my head because he dropped a lot of things in there. Remember when he said that he thought that it was supposed to be a man that came and then they sent a woman and he was like, yo, what's going on? The thing is, when you actually go to their site and when you go to other sites about Cabo San Lucas, they say that for no fee, they will send they will send doctors to make house calls in emergency situations. And guess what? All the doctors listed are men. Okay. And we have a little information about her medical history. She says that she's a general doctor. She says she's into more tech coordination. She didn't want to specialize, but she's listed as a specialist in childbirth and OBGYN in the Jalisco states, because she went to the University of Guadalajara in the Jalisco state. Her medical license number is 350527. I know I just dropped a lot on you guys. So let's decompress. Let's be thankful that there is new hope. The American authorities are on the local people that were involved, right? The thing I do think that we keep needing to press on is to see if this case can stop extradition and everybody can be tried in the US, because don't forget the FBI is working with the Mexico government to collect evidence. So instead of us helping them collect all the evidence, overseeing, because the FBI has more questions than the Mexico government about what's the doctor's role, what's this, what's that. If we can stop extradition, right? We saw what happened with the Ohio University student case. We saw what happened in the Matthew Teller case. We saw what happened in every case when America stops extradition. I firmly believe that justice can be served quicker and better on American soil. But let's get into what the new hope is, because for a second I was losing hope. Now, this is not to say in any way, shape, or form, let me pull it up and read it for you. This is not to say in any way, shape, or form that we should take our foot off the gas. Absolutely not. But listen to this, right? They're saying, regardless of the fact, right, of what happened, and regardless of the fact that the Mexico authorities put the cause of death as alcohol poisoning, and the U.S. State Department believed them and put that down as cause of death, they're saying, regardless of that fact, the FBI has managed to find out that Dejanay Jackson, through that video, is the person who attacked and ultimately Shanquella Robinson, right? And they're saying that Khalil Cook is the person that recorded the video that went viral. Now, I do have to say this, right? I think at this point, anybody's speculation until we get an official word from the investigators of arrest. There was a man standing there on the side with his beard. It could have been Khalil, but also Malik Dreyer had a little bit of beard too. Now, I will say that Shanquella's mother and her sister, who spent time with Khalil, believes that it's Khalil with the beard. So there is a mystery person that was recording. We're assuming it's a man because we see one of the women, we see another woman recording, and then we don't know if it's the same male voice or not, but it could be a man or a woman. But that's not it, right? The FBI, this is the hope. The FBI, not Mexico authorities, because as the local reporter said, they don't think that, it's the friend's fault because they told the doctor what the diagnosis is. I don't know where anywhere on earth when you walk into a room and you told the doctor what the diagnosis is and the doctor doesn't say, ignore you and still do their own evaluation, okay? Oddly enough, I did look at, can CPR cause luxation or any trauma to the neck? They say it is possible to cause trauma to the spinal cord. However, it is very rare. But you know what? If you look at the studies on CPR with older people that have suffered trauma and also people that are conscious, they say because CPR damages the lungs, can cause injury to the spine. It can even cause injuries and lacerations to the spleen and to the liver, as well as things in your what do you call it? In your throat region, the lumbar region, and all over. They say that, and this is medical training, if you see any signs of trauma, do not attempt to do CPR. Get them to a hospital if possible. Now, if we're out in the middle of a war zone and there's no hospital and there's trauma, okay, fine, do CPR, because at that point, that's the best bet. But the fact that there was a hospital close by that villa that had all the state-of-the-art equipment, and she chose not to take her there, not to follow current medical procedure. This is the doctor right here, Dr. Carolina, right? The fact that they chose to do that, Miss Carolina Ornelas, the fact that she chose not to do that, and she blamed the friends as telling her, why would you let somebody that's not Mexican make that decision for you? But let's get back into the hope, because we can get into that mess later. The new hope. Okay, I'm sorry, we're on. The FBI is also investigating the omission and the negligence, the FBI, of the Mexican authorities for the series of inconsistencies, lies, and contradictions in the case. They're saying, if these local reports can be believed, that it's most likely they are putting pressure on the government of Mexico and the government of Baja California Sur to determine who is liable, responsible, guilty, right, for the people that were supposed to save Shanquella's life not doing their jobs correctly. It is Miss Dr. Carolina Ornelas, the Los Cabos municipal police officers, Omar and David, the agent of the public ministry of PGJE, that's the region for California, Sir Julio Daniel. The FBI is looking into this. For whatever reason, and we're coming to see, all this stuff happened down in Mexico. They were allowed to leave. Shanquella's family was like, what? Right? The FBI got involved and said, what? They said, no, we have a video. It's clearly Dejanay, right? It might be other people we're seeing. The FBI said, what? What do you mean? What do you mean? Because you can sit here and spread all these things you want. We have doctors. We know that there is no way in the world that a doctor performed CPR 14 times, 5 electroshocks, and you didn't know a person was there. Let's also, look, the heavens shook. The heavens shook. That was a sign that we're on the right path. All right. So we're looking at that. Now let's move into some other stuff. So that is the hope. The FBI, not Mexico authorities, are the ones on top of looking into the police officers, the doctors, and the municipal authorities, because the FBI are saying, none of you guys follow procedure. There are inconsistency. How is the autopsy saying that she died at 3 p.m., but yet, right? But yet, your doctors say that you performed CPR for 3 hours. Now, I do want to say this. I have it later in the thing, but we'll talk about this in a minute. But you guys know that CPR usually lasts for like 2 or 3 minutes. Most people, and when I say people, I mean medics, say after 9 minutes, you can maybe stop. Most people say 20 minutes is a good time to stop. The fact that this woman, the fact that the police, the fact that nobody followed procedure, the fact that they said they gave IVs, an IV only takes 60 minutes. If she had transcended at 3 p.m., there's no way you can give an IV when there's no circulation going on. It is lie upon lie upon lie. And even though it seems like Mexico wants to push the blame off of the Cabo 6, if we want justice, true justice for Shanquella, yeah, we want the Cabo 6 to go down. Yes, we want Dejanay sitting under jail. I still am now voting for an American jail, right? Yeah, we want that to go down. But also, the U.S. government's interest, I would imagine, is in making sure that there's never a situation where Shanquella goes that happens again. Why? If we think that at best, right, best case scenario, this doctor, Miss Carolina Ornelas, the 2 police officers, and also that technician, why, if they were so faulty, right? Why, if they were so faulty with everything they're doing, why would we want them out on the street? Why should they be able to practice again? You could not tell by a woman that had a lump, bruised up eye, lip, all this stuff, that there was trauma. You should maybe check the person, or at least rush them to a hospital for them to get their blood alcohol content checked immediately to see where they were, get their stomach pumped, oxygen tube down their throat. This is standard for alcohol poisoning. You didn't think to do that. You sat there with an IV bag like it was Pedialyte, sitting there on the floor looking stuck, right? You had the 2 Salvation Army EMTs also sitting there looking stuck. Nobody knew that, according to the autopsy, that you guys were doing procedures on a body that was not alive. And somehow there are people that think that it's fair to let this person go along with their life. Now, listen, I don't know if she needs to be in jail too. We need to check her checking account and see if there was anybody paid off. But I am saying that I would imagine the FBI and the authorities are actually saying, we cannot have this person practicing medicine. We cannot have these EMTs around. These EMTs, the police, everybody that was involved, you are a danger to society. You are a danger to tourists. You are a danger to your own citizens. If you can't tell the basics, why are you even here? And if you fumbled this so bad, what's going to happen next time? We cannot, again, in the United States, we call it malpractice. Sometimes malpractice rises to the level of criminal malpractice, sometimes it stays at the time where it's like, we need to snatch your license, or you shouldn't be allowed, or you need retraining. The fact that anybody, and I hope it's not the Mexico government, is thinking about just letting them off the hook, who would ever stay in that villa again? You guys, this is Miss Carolina O'Neillis. I do want to point out a few things. This is the clinic she works at. It is the AMC Hospital in Cabo San Lucas, right? That is the big hospital. There's also a walk-in clinic. This is the AMC walk-in clinic. It's a very humble looking clinic, right? Again, Cabo is a beach town. This is for emergency care. Most of the things they do, getting swabbed, if you need a booster, if you need like your travel papers, you guys know how emergency care is, especially in resort towns. They are not doing surgery. The AMC clinic I showed you is the hospital that she asked the friends, could she take her to? As a doctor, why are you asking people on the scene, can I take you to the hospital? Especially when none of them are next to kin. The correct thing is we are taking her to the hospital. None of you are next to kin, and forget about next to kin. If none of you guys have power of attorney over her and can speak and have control over her welfare, if you are not a parent or if you do not have power of attorney, right? And a parent, if she was a minor, it's none of your business. As a doctor, I swore an oath that I will protect her life. And if what you are saying is counter to protecting her life, unless you have a legal document saying you have the right to override me, she's going to the hospital. Again, this is why the FBI is investigating her, because the math's not mathing. Something's not adding up. And I would say, look in everybody's bank account. Let's keep on going. This is the clinic. Now, interestingly enough, again, these are the doctors that if you want a house call usually come out. Remember when Nasir said he thought a man was coming. He thought a man was coming. There are 2 doctors listed as the doctors that will come and make house calls. They come 24/7. The hospital is open 24/7. But there's more. Hold on, guys. Let's get into this. This is the Jalisco area where Dr. Carolina, with a K, not a C, Carolina with a K, actually studied. It is in the Jalisco University of Guadalajara. This is Dr. Carolina. Now, you guys, I was really curious at someone that would be this incompetent if the reports can be declared. Dr. Carolina herself said, she tries to launch apps. She's in tech. She is, hold on, let me check my notes. She did a podcast in 2020. Okay. And she actually said that she's not really into actually practicing medicine. She's more into coordination, into maybe observing, helping teachers coordinate. She likes to be, it seems like, on the business and tech side. I will say that even though she seems to be a ghost on the internet, meaning she seems to be a young lady, but she doesn't really have Instagram, Facebook, unless she has it under a burner account. Okay. It's unclear how much experience she has in medicine. Again, she said in 2020, she graduated somewhere around that time. It's unclear how long she's been practicing medicine. But honestly, I will say when it comes to CPR and that type of stuff, you learn that in first year of med school. So the fact that she graduated medical school from the University of Guadalajara, she should have known. Again, this is why the FBI is looking into her. She did say, this is when they were talking about another app where it was making it easier for patients to access their file. Again, she's more interested in the admin angle of medicine. That would explain why she didn't know that she was dealing with a body that didn't have life, if the reports can be believed. She said, my contribution to this project was project manager. This was my first project as team leader. It was very rich to me as an economics and as an IT student. She listed herself as a physician, an entrepreneur, and an amateur designer. Again, I'm not knocking her. Do what you do. My question is, like the FBI said, why, if they tell someone that it is alcohol poisoning? I feel like a lot of people are confusing alcohol poisoning with being drunk, being woozy, no, alcohol poisoning is when you are poisoned. You are poisoned. Take out alcohol poisoning and put in cyanide poisoning, right? Put in cyanide poisoning. Does that let you know if somebody says, oh my God, they've been poisoned by cyanide? Would you appreciate a doctor showing up your door, doing CPR on you for 3 hours, right? And having a bag of Pedialyte fluid, basically? Would that cut it? Or would you say, rush my loved one to the hospital? What are you doing? They have been poisoned. They have been poisoned. All right. But let's move on. We also have, and now this is something interesting I wanted to share with everybody. So even though in her podcast, she says that she practices medicine generally, right? And the reason is because in Mexico, when you specialize in something, you have to be recertified every 5 years. When you are a general physician, it looks like you don't need that 5-year recertification. Interesting enough, it says right here, she is listed right here under medical license 350527. She is listed as professional temporary professional license. Again, all specialists, OBGYN, surgeon, whatever. If it is a specialty, they must recertify every 5 years. That's why it says temporary. Interesting enough, she is listed as an OBGYN, right? However, when you search through the whole state's medical records, she doesn't come up anymore. It is unclear as to whether she had a valid license to practice when she was at that clinic. Speaking of that clinic, I had a few people call down there. They are saying that she is no longer employed in the clinic. They're saying, now again, this probably could be because every YouTuber in the world is calling down there and concerned citizens. The FBI has been snooping around. The block is hot. For whatever reason, they're saying that she is no longer there. Let's keep moving. So here's my whole thing. She's listed here as being an OBGYN, but she says in her podcast in 2020 that she's not. And this list came out, I believe, in January 2020 or 21. Her podcast came out in June of that same year, in which she says that she just practices generally. Again, this is her name. How do we know that? Because her name is actually spelled with a K, Carolina. Oddly enough, in Mexico, Carolina is usually spelled with a C. So her name, the spelling of her name, much like Dejanay's, is very unique. Let's keep going. We also have just more information on what it is to be have a provisional license. Let's get into the CPR. Why is it impossible she did CPR for 20 minutes? Aspiration, vomiting, broken ribs, internal brain injuries, abdominal distension, that's when your stomach swells, and aspirational pneumonia, which means that you get bacteria, foreign bacteria in your lungs from when they're breathing into it. And that, of course, these are, again, your liver and your spleen can have lacerations, even be crushed and damaged with CPR. They're saying if CPR is not performed within 2 minutes of cardiac arrest, brain injury can occur. But after 9 minutes, brain damage is extremely likely. The chance of surviving cardiac arrest after 10 minutes of CPR is incredibly low. You guys, there's more. How long do doctors do CPR before giving up? The current NAMSP literally says, and this is the council, literally says that the European Resuscitation Council recommended 20 minutes of on-the-scene efforts before terminating efforts. This has changed a lot. Some people say 9 minutes. Some people say a little bit more than 20 minutes, but we can all agree that 2.5 hours is excessive. Get this, and I thought this was important. They said that they did 14 rounds of CPR. This is what they're saying. That's why she was working with her for so long. Okay, 3 hours. Keep in mind that the average time to complete 5 cycles of CPR is approximately 2 minutes. So let's get this straight, approximately 2 minutes for 5 cycles of CPR. That means since she did 14, to be generous, you perform CPR for 10 minutes. What else were you doing when you were in that villa? Maybe this is what the FBI wants to know. We also have, this is the last thing I'm going to leave you in. I'm going to have to do this in a part 2 because I know this video is getting really long. The risk of CPR. The lack of oxygen while CPR is being performed can cause significant injury to the brain and other organs. This can leave individuals depending on others for care in a persistent vegetative state. CPR can break ribs and cause severe pain. Survivors likely face a long hospital stay and rehabilitation. You guys, there's another video I have about this because something is not adding up. And I'll talk about it in the next video. But you guys, there is a petition. Just Google Shanquella Robinson petition. I would put it in the description box, but oddly enough, when there's outside links, YouTube actually slows down sharing videos. And I wanted to get the word out as much as possible. However, there will be a link to the petition, and we are going to actually discuss it tomorrow. And also, I'll see if I can put a link to the petition in my comments. It will be a pinned comment. Please make sure you guys click and sign. Justice is coming, but I firmly do believe that we need that justice on American soil. Anyway, you guys, let me know what you think in the comments, and I will talk to you later.